So we are moving on to the urinary or male system. So we have scenario number 6, and once again, I would invite Ms. Katoya to come onto the floor and read the scenario for us.
Okay. Preoperative diagnosis, right ureteral stones. Postoperative diagnosis, right ureteral stones. Operation, open right ureterolithotomy. Intraoperative findings. The patient had marked inflammatory reaction around the proximal ureter, just below the renal pelvis. Multiple stone fragments were embedded in the edematous uteral lining. Procedure. The patient was placed on the operating room table in the supine position. General anesthesia was induced. He was then placed in a right flank up position. An incision was made off the tip of the 12th rib and dissection was carried down through the skin, fat, and fascia to open the lumbodorsal fascia, entering the retroperitoneal space. The peritoneum was swept anteriorly. Careful dissection was then carried down in the retroperitoneal space to first identify the vena cava and then to identify the renal vein. Once these structures were localized, the ureter was identified. Careful dissection was done to mobilize the ureter and to identify the area of the stone impaction by palpation. The ureter was then opened longitudinally and the ureteral ureteral stent was identified. The multiple embedded stone fragments were then removed from the ureteral lumen. The ureteral lumen was then irrigated copiously and no other stone fragments were identifiable. The ureterotomy was then reapproximated with interrupted sutures of 5-chromic. Inspection showed good homeostasis. Sponge and needle counts were correct and the closure was begun after placement of a Blake drain through separate inferior stab wound. Marcaine 0.5% with no epinephrine was used to infiltrate the intercostal nerves. The wound was then closed in layers with muscle and fascial approximation with number 1 Vicryl. The skin was closed with staples. Sterile dressings were applied. The patient returned to the recovery area in satisfactory condition. And I forgot to read the answers. A was 50610.920.1. B is 50630.920.1. C 50945 N20.1, and D is 50088 N20.1. What are the CPT and ICD-10 codes reported? You have 2.5 minutes.
Okay, Goresh, so that's time. And yeah, I can see the answers are coming in now. Okay, please continue to work on the scenario if you haven't finished yet. If you want to take a screenshot of the question, please feel free to take the screenshot as well. So since we are short of time, I will start reviewing the scenario. So we have preoperative and postoperative diagnosis, both are same. Right urethral stone. We had an open ureterolithotomy procedure performed. Inflammatory reaction was seen around the proximal ureter. Patient was placed in supine position. General anesthesia was given. Right flank up position, and tip of the incision was made around the tip of the 12th rib. Dissection, peritoneum was wet. Dissections were carried out to the retroperitoneal space. Ureter were identified. Ureter was opened, and multiple embedded stone fragments were removed. And was ureteral lumen was irrigated copiously. Patient returned to the recovery room. So that's all what we have in this scenario. So once again, thank you, Ms. Katoya, for reading that scenario for us. And now let's come back to the coding. We have a procedure inventory. We have open right ureterolithotomy procedure performed. And in diagnosis inventory, we have right ureteral stone. So this is the anatomy of human urinary system. And we have a pair of kidneys, a pair of ureters, a bladder, and urethra. So urinary stones are one of the most common conditions for which patients will come to the urology department of a hospital or clinic. So what are urinary stones? So these are the stones which will be formed in any part of your urinary system. So if it is present in your kidney, if there is a stone formation in your kidney, call it as a kidney stones. If it is present in the ureter, it's called ureteral stones, or can be also present in your bladder and urethra as well. So depending upon the location, we will call them, we will give them different names. So in our scenario, patient had a urinary stone in the ureter. So we had a right ureteral stone, and the doctor performed a open right ureterolithotomy in order to remove that stone. So that's all about the procedure performed, and these are our code options. Option D 50080 is coding for a percutaneous nephrolithotomy procedure. We didn't have a percutaneous nephrolithotomy in our procedure inventory. We have a open right ureterolithotomy performed. So option D is incorrect. Option C is coding for 50945, that is for a laparoscopic surgical procedure. And once again, we didn't have a laparoscopic procedure performed in our scenario. We had an open procedure performed, and that's why option C is also incorrect. And between option A and option B, yes, between option A and option B, both are almost similar, but we have different location. The procedure performed different location. So in option A is calling for ureterolithotomy for upper 1/3 of the ureter, and 50630 is coding for ureterolithotomy, which is performed on a lower 1/3 of the ureter. So how do I know at which area or which location of the ureter was the procedure performed? Once again, referring back to the documentation, you can see that patient had a marked inflammatory reaction around the proximal ureter. So the ureter can be divided into upper third, middle third, and lower third. So the proximal portion of the ureter means that is the upper third, right? That is near the kidney, the upper third. So that's the proximal ureter. So patient had an inflammatory markers around the proximal ureter, and that's where the procedure performed in the scenario. which means option B is incorrect, which is calling for the retrolithotomy of lower one-third of the ureter. The correct answer is going to be option A, as most of you have said, axial encoding. That's going to be retrolithotomy of upper one-third of the ureter. Okay, that was a little bit tricky scenario. Okay, I hope the explanation helped. Please let me know in the chat box if you have any questions. So I will quickly move on to the last scenario. I will quickly read the questions for you, the answer and the question for you all. Option A 51530, option B 52234, option C 52240, option D 52214. The ICD codes are C67.0, C67.5, C61. Operation note: preoperative diagnosis, gross hematuria; postoperative diagnosis, bladder or prostate tumor; operation transurethral resection of bladder tumor, TURBT, large 5.3 centimeter, anesthesia general. Findings: patient had an extensive involvement of the bladder with solid and edematous appearing hemorrhagic tumor completely replacing the trigone and extending into the bladder neck and the prostatic tissue. Ureteral offices were not identifiable. Digital rectal examination revealed nodular firm mass per rectum. The procedure description: the patient was placed on operating room table in a supine position and general anesthesia was induced. He was then placed in lithotomy position and prepped and draped appropriately. Cystoscopy was done, which showed evidence of ureteral trauma due to the traumatic removal of the Foley catheter. The bladder itself showed extensive clot retention. There was papillary and necrotic appearing nodular tissue mass extensively involving the trigone and bladder neck and prostate area. The ureteral office were not identified. After consulting with the patient's wife and obtaining an adjustment to the surgical consent, the tumor was resected from the trigone, bladder neck, and prostate. Obvious edematous and hemorrhagic tissues were removed. Extensive electrocauterization was done for bleeding vessels. Several areas of necrotic appearing tissues were evacuated. Care was taken to avoid extending a resection into the area of external sphincter. Digital rectal examination revealed firm nodular mass with anterior rectum and no impact stool was identified. At the end of the procedure, the hemostasis appeared good. Tissue chips were evacuated from the bladder. The Foley catheter was inserted. Patient was taken to the recovery room in satisfactory condition. Attendant patient had previous partial prostatectomy and had found to be have T2B NOMX prostate cancer. On physical examination today and on endoscopic exam, it was unclear as to whether the tumor was related to the bladder or recurrent prostate cancer. Pathology revealed bladder carcinoma in trigone and bladder neck and recurrent prostate cancer. Okay, coders, so we'll make it quick and your time starts now. Okay, Cordes. So I'm sorry, I have to start explaining the scenario now, because we don't have much time, and I don't want you all to extend beyond the scheduled time. Okay, so please forgive me for that, and I will walk you through this scenario. We have a transurethral resection of bladder tumor performed, which is TURBT procedure. Patient was placed in supine position, anesthesia given is general anesthesia. Patient was placed in lithotomy position, cystoscopy was done. Papillary necrotic appearing nodular tissue mass extensively involving the trigone, the bladder neck, and the prostate was resected. The tumor was resected from the trigone, bladder, and prostate. Areas of necrotic appearing tissues was evacuated. Tissue chips were evacuated from the bladder. Follic catheter was inserted, and the final diagnosis is going to be a bladder carcinoma in the trigone and bladder neck and recurrent prostate cancer. So in the procedure inventory, we are having transurethral resection of bladder tumor, large of 5.3 centimeter. Where did I got this? It is over here in the procedure note itself. And diagnosis inventory, I'm having a bladder carcinoma in the trigone, bladder neck, and recurrent prostate cancer. So option A is coding for 51530, which is for cystotomy for excision of bladder tumor. Well, we didn't have a cystotomy procedure performed. We had a transurethral resection of bladder tumor performed. So both are two different procedures. Yes, both are two different, totally different procedure. And option D is coding for 52140, which is for a cystourethropy with fulguration, including cryosurgery or laser surgery for trigone, bladder, neck, prostate, fossa, urethra, and periurethral glands. Once again, cross-checking with our procedure inventory, we have transurethral resection of bladder tumor, and 52214 is coding for a cystourethropy with fulguration of bladder, neck, prostate, fossa, and urethra and periurethral gland. We didn't have any fulguration of these tissues. We had a resection of bladder tumor. So that means option D is also incorrect. Now between option B and option C, 52234 and 52220, both are difference. Only difference between both codes are in the size of the tumor which has been removed. And 52234 is coding for cystourethropy with fulguration and or resection of small bladder tumors, 0.5 up to 0.2 centimeter. And we had a 5.3 centimeter bladder tumor removed in our scenario. So the correct answer would be 52240, which is for cystourethropy with fulguration and or resection of large bladder tumors. So those are the tumors which is above 2 centimeter size. So that option C is the correct answer. And all you have to do is get your inventories correct and select the code that best matches your inventory list.
Thanks for tuning in, and until next time, happy coding!